Mass Care and Sheltering in the Emergency Operations Center. Welcome to a just-in-time training based on the Bay Area Catastrophic Earthquake Mass Care and Sheltering Plan. This video integrates training of the Regional Interim Housing Plan as the fourth operational phase of mass care and sheltering. Following a disaster, many people may be displaced from their homes or lacking necessary supplies for survival. They may be in need of temporary shelter, food, water, sanitation services, and other life-sustaining commodities. Fortunately, there is a system for local government to coordinate key organizations to respond and help deliver goods and services to those in need.
Our chief place for the coordination and problem solving is in the Emergency Operations Center. One has to remember that the responsibility for taking care of their citizens rests with the government.
As the Care and Shelter Coordinator in the EOC, you will coordinate with your colleagues inside and outside of the EOC to support the activities that help connect survivors to resources in times of disaster. You've checked in, received the appropriate vest, and been assigned a workspace. You may not have worked in an EOC before, or maybe you are not familiar with the missions of mass care and sheltering. That is okay. There are resources and people that will help you be successful. Although this time is stressful, the EOC team will work with you to support a smooth response and expedient recovery. During this 25-minute just-in-time training, we will introduce the operational phases for mass care and sheltering, your core responsibilities, and how to prioritize objectives within the first 60 days following an event. This just-in-time training is one in a series based on the 8 Bay Area Catastrophic Earthquake Plans. The introductory video includes basic EOC responsibilities and an introduction to the Standardized Emergency Management System, or SEMS. It may be helpful to refer to the Bay Area Regional Catastrophic Earthquake Mass Care and Sheltering Plan, the Bay Area Regional Catastrophic Earthquake Interim Housing Plan, or your local government plans if applicable as you watch this training. You can also reference California Emergency Function 6 Care and Shelter Annex for help. This training focuses on supporting mass care and sheltering from an EOC. Keep in mind that your role may be slightly different based on your level of government. Stick around to test your knowledge of mass care and sheltering operations with a quiz at the end of this video. This training focuses on the first 60 days following an event, broken into 3 distinct time periods. The first 3 days, or 72 hours, day 4 through 14, and the 6-week span between day 15 and day 60. We will also discuss coordinating interim and long-term housing which will last beyond 60 days. To help you understand your role in the EOC, it is important to first understand the role of the American Red Cross as a partner in coordinating shelter, feeding, and volunteer functions, and the operational phases of mass care and sheltering. The American Red Cross has a Memorandum of Understanding, or MOU, with both FEMA and the state of California that establishes their role, which includes but is not limited to shelter and mass feeding operations and coordinating with other volunteer agencies in a disaster. Your jurisdiction may also have an MOU with the American Red Cross. Most often, the American Red Cross provides a liaison to the Care and Shelter branch within the EOC. Ask your EOC supervisor for additional information about your EOC's relationship with the American Red Cross.
Red Cross's role in disaster primarily is to meet the humanitarian needs that are created by the disaster. We're meeting the impact of the disaster in the community. So if you think in terms of what does a person normally need on a day-to-day basis, they need a place to live, they need food to eat, they may need medicines, they've got to have clothing to put on, transportation, sense of well-being and information.
The 4 phases of mass care and sheltering operations are event analysis and evaluation, establishment of shelters, ongoing shelter support, and the transition to interim housing, including the demobilization of shelters. During the first operational phase, an immediate inventory of available shelters, supplies, and services will be conducted. Estimating the number of people who need care and shelter services will be essential.
Are we doing really appropriate and detailed damage assessments? Do we know where the most affected areas are and how severely have, for example, residential units been affected versus, say, individual homes?
So we're going to be getting a lot of information from people that are out in the field. And then we're also working very closely with the Department of Building Inspection up at the Emergency Operations Center, because they're going to have a lot of information about which buildings are viable and which buildings are not viable.
During this time, inspectors will begin conducting building checks to ensure structural safety in shelter locations. The Mass Care and Sheltering Plan coordinates with the Mass Transportation and Evacuation Plan to establish pickup points, locations for displaced disaster survivors who cannot find shelter in their communities and need to be moved to government-run shelters. Once building checks are complete, shelter locations will be established. Types of shelters include spontaneous or community shelters, temporary government shelters, and primary shelters. Decisions regarding the opening of shelters should be made by the Care and Shelter branch within the EOC. Work with your American Red Cross liaison or reference Appendix B of your local plan for potential shelter locations and available sheltering resources such as cots and blankets. Following a catastrophic event, there may be a significant shortfall in shelter capacity due to facility damage or inaccessible transportation routes. Community organizations such as churches or community centers may open spontaneous or unplanned shelters. These shelters may not initially meet government shelter standards, yet they provide a valuable service in the immediate hours after a disaster. An EOC may be called upon to provide government support or supplies to sustain operations of spontaneous shelters. Ongoing assessments of spontaneous shelter locations and their needs may need to be conducted. During this phase, establishing temporary and primary shelters will be the priority for the Care and Shelter branch. Temporary shelters typically only operate for a maximum of 1 week. Primary shelters may operate up to 60 days after an event and should accommodate affected populations, including those with disabilities and others with access and functional needs, as well as those with service or companion animals. For those in need, primary shelters will coordinate to provide access to necessary services at medical conditions shelters. In past events across the country, some areas have established mega shelters serving over 1,000 people. The Bay Area has indicated this is not a preferred sheltering option, and policy leadership must be consulted if this shelter type is being considered. Most shelters will be managed by a combination of local governments, non-governmental organizations such as the American Red Cross, community-based organizations, CBOs, and faith-based organizations, FBOs.
We're a nonprofit that's all over the United States in various different places with our relationships with government, but we're there to help the government take care of their citizens.
Several activities take place to support shelters during the third operational phase, including replenishing supplies and providing additional staff for operations. As a part of ongoing support, shelters must be prepared to accept people with disabilities or others with access and functional needs. Shelters must follow the American Disabilities Act regulations for design standards.
Making sure you're thinking about from the time a person gets off a bus, say in front of the facility, to the entrance, to the actual opening area of where the cots and the services are going to be set up, to the restrooms, ensuring that the restrooms are accessible.
Ongoing shelter support may also include providing feeding and shelter supplies for service and companion animals. In coordination with local government, local assistance centers or LACs may need support to provide a centralized location for services and resource referrals. LACs play a critical role in reconnecting disaster survivors to a more normal lifestyle. A State Functional Assessment Service Team, or FAST, can be requested through mutual aid to ensure that all shelter populations are being served adequately. More information on the FAST program can be obtained from the California Department of Social Services, or CDSS. The last operational phase is demobilization and interim housing. For more details, refer to the Regional Interim Housing Plan. This occurs when shelters close and as residents are able to return to their homes or transition to interim housing.
We need to transition those people to long-term solutions while their homes are being rebuilt or new apartment structures are being created for them to move into. Actually, the EOC doesn't have a large role in coordinating housing. It's actually the state coordinating housing task force that has that primary responsibility. But the EOC still has some critical functions to perform to support that function.
You may have a care and shelter task force within your jurisdiction. For large-scale incidents, a state-coordinated housing task force will most likely be established for coordinating across different levels of government. This task force establishes an interim and long-term housing plan that includes defining responsible parties, resources, locations, and the consideration of insurance and accessibility. Task force members can include EOC staff, subject matter experts, and representatives from relevant agencies. The task force is designated for long-term operations and may remain active beyond demobilization. Interim housing is used until businesses, homes, and the community functions are re-established. At that point, residents re-enter their communities as outlined in the Mass Transportation and Evacuation Plan. Let's review the 4 operational phases of mass care and sheltering you just learned about. Event analysis and evaluation, establishment of shelters, ongoing shelter support, and the transition to interim housing, including the demobilization of shelters. Your core responsibilities within the EOC to support care and shelter operations are communication and coordination, resource management, information management, and assisting with public information. Communication and coordination refers to your role as the link between government and the many agencies and organizations that provide support and resources for care and shelter services. First, we will discuss coordination with government agencies. You will interact with your counterparts in other government agencies as appropriate, including at the field, local government, operational area and regional levels, the State Operations Center, or SOC, and the Joint Field Office, or JFO, where federal resource coordination occurs. Inside the EOC, you will likely be sitting in the Care and Shelter branch or unit within the Operations section. You may also work directly with other branch, section, and unit staff within your EOC and other EOCs. In the Logistics section, the Transportation branch can help you coordinate moving people from established pickup points to shelter locations, including transportation from primary shelters to shelters serving those with medical conditions. The Transportation branch may also help you coordinate moving pets with their owners. You will work closely with the volunteer coordinator to manage the necessary volunteers coordinated through the American Red Cross and other affiliated organizations. In the Operations section, the Medical Health branch can help to ensure support for survivors with medical conditions is provided. It will be important to work with the Animal Control or Animal Care unit to provide effective animal care and sheltering resources to pet owners. You will communicate and coordinate with non-governmental organizations or NGOs, CBOs, FBOs, and private sector businesses. Key partners may have a designated agency representative, sometimes referred to as an AREP, in the EOC. The agency representative will check in through the liaison officer in order to offer resources from their organization. Some key partners include American Red Cross, VOADS, Humane Society, and private sector businesses. In California, many NGOs are organized into VOADS at the local and state level.
VOAD stands for Voluntary Organizations Active in Disaster. So it's actually a network or a membership organization of all of these different types of organizations that play key roles in disaster. In many cases, they will send a representative or a liaison to the EOC.
VOADS can provide volunteers to support care and shelter operations at all levels of government.
An emergency operations center works with the Humane Society or the folks who shelter animals during non-emergency sites. It's a true partnership.
Private sector pet supply companies may serve a key role in meeting the needs of survivors and their pets. Let's summarize what you learned about communication and coordination. You will work with partners inside and outside of the EOC. Many non-governmental partners may have agency representatives within your EOC to facilitate communication and coordination with their agencies and their resources. Key partners include the American Red Cross, VOAD, Humane Society, and private sector businesses. Resource management involves brokering various types of requests that go both directions. It is likely that in your role, you will make requests to other levels of government and also respond to requests that you receive. The type of resources that may be requested include assistance in securing facilities, staff, and supplies for care and shelter operations, resources to support local assistance centers that provide services to survivors, and logistical support for sheltering residents with disabilities or others with access and functional needs. Keep in mind that serving access and functional needs populations may require significant resources and heavily depend on the EOC resource request system.
You gotta find experts on access and functional needs who can help you make good decisions, but most importantly, help you get the resources that you're gonna need to respond properly and thinking of the short and the long-term processes that you have to deal with.
Contact the Cal OES Office for Access and Functional Needs for help on how to fulfill these requests. It is your responsibility to fulfill submitted resource requests using resources within your jurisdiction first. If the necessary resources are not available, you may complete and submit an EOC resource request form to the next higher level of government, such as the operational area or state. Ask your section chief how to access your EOC's resource request form. Be aware that resource requests and other forms may be prepared electronically using a software tool such as Web EOC if available. You may turn to NGOs and private sector businesses to fulfill requests for care and shelter needs, such as pet supplies or equipment for access and functional needs populations, as well as resources for interim housing. Let's review what we learned about resource management. Working in the care and shelter branch or unit in the EOC, you will receive requests from the field or other levels of government. You may make requests for shelter facilities or supplies. Use the EOC resource request forms if you are unable to fulfill requests with resources available in your jurisdiction. Keep in mind that NGOs and private sector businesses may also provide care and shelter resources. Information is vitally important. You will track information to be shared with others in the EOC, for the development of situation status reports, and for public messages to be delivered by a public information officer.
For mass care and shelter decisions, you need to know as much about the population that's evacuating as you can. How many people are evacuating? What can you know about that population? Do they have access and functional needs, social needs, public health needs? Where is the destination that you're going to be relocating them to? How many shelter locations are available there? Do you have adequate space? Can you get shelter supplies to those locations?
Check your local or operational area plans for information collection guidance as you carry out this task. Let's review the essentials of information management. Collect the necessary information to regularly communicate with internal EOC and external private sector and nonprofit partners to support the care and shelter function. Track essential information such as numbers of people needing shelter, available shelters, and quantity of supplies. Data you collect will be used for situation status reports and public information. And refer to your plan for information collection guidance. The EOC will need to communicate to the public the ongoing status of shelter and feeding locations and their hours of operation. You are responsible to provide accurate and timely information to the Public Information Officer, or PIO, who is responsible for message delivery to the public. You may also be asked to send this information to the Joint Information Center, or JIC. Here are examples of public messages that you may need to provide to the PIO.
Shelters for the general public are open at these locations. Find a local pickup point if you need transportation to a shelter. Look here for what you can and cannot bring to a shelter. If you do not need shelter but need a meal, you can come to this location between these times. Resources to shelter and care for your pets are available at a specified location.
Work with a public information officer to find available pre-scripted public messages. 211, or sometimes another designated number, is a toll-free 24-hour call center that connects callers with community resources and can help provide care and shelter-related information for the public. Let's review your role in getting information out to the public. Contact the PIO and the JIC to coordinate critical messages. 211 can be used as communication resource. Modify pre-scripted messages as needed. Look to your plan's response timeline as a guideline for prioritizing objectives within each disaster response time period. During each phase, you will implement action steps for the core responsibilities you just learned about. The priority in the first 3 days will be to gather information regarding the incident to identify the community's needs for care and sheltering. Most jurisdictions will need to work with the American Red Cross to execute this function. Core objectives for the first time period include gather damage assessment information, begin building inspections, and develop situation reports. Evaluate the transportation network to move people and supplies to shelters and feeding sites. Coordinate access to shelter locations from transportation pickup points. Notify partner agencies of situation status and the need to coordinate services. And coordinate public information regarding shelter openings and feeding sites. During days 4 through 14, the priorities are to continue building inspections and open shelters. Objectives to carry out during this phase include open shelters to accommodate affected populations and their service or companion animals. Identify the needs of shelter residents with disabilities or others with access and functional needs. Manage resource requests. Operate feeding sites and provide bulk supplies as available. Coordinate with other EOC branches such as the Transportation Branch for road and transit capabilities to move people and supplies into shelters. Continue coordinating public messaging. And establish local assistance centers. The priorities for days 15 through 60 include continuing to operate and support local assistance centers, as well as facilitating the transition from primary shelters to interim housing. Your objectives for the third time period are maintain ongoing situational awareness of care and shelter services. Continue to coordinate resource support for local shelter operations and feeding sites. Continue coordinating with the American Red Cross to support local assistance center operations. Continue coordinating public messages, especially regarding shelter closures. Initiate the transition from primary shelters to either permanent or interim housing. It is likely that the need for care and shelter services will extend beyond 60 days. Your objectives for the interim housing time period include working through the State Coordinated Housing Task Force, coordinating with partners such as the Department of Real Estate and Chamber of Commerce, facilitating the return of disaster survivors into permanent housing. Refer to your supervisor in the EOC for a checklist to help you establish appropriate priorities and objectives during your EOC assignment. An example checklist, such as the one shown here, may be found in your plan. Mass care and sheltering is vitally important to Bay Area response efforts following a catastrophic event.
If you're working in an emergency operations center, you can't think of it as being in a position. You're not filling a position, you're filling a role as a team.
This is the most important one, I think, is don't be afraid to ask for help.
As a result of this introductory training, you should take away a better understanding of your role as the Care and Shelter Coordinator in an emergency operations center. Here are some resource references to learn more about the care and shelter function at various government levels. These include ESF 6 Mass Care, Emergency Assistance, Housing, and Human Services Annex to the National Response Framework. Emergency Function 6 Care and Shelter Annex to the State Emergency Plan. Care and Shelter Subsidiary Plan to the Regional Emergency Coordination Plan. The Regional Catastrophic Earthquake Mass Care and Sheltering Plan. The Regional Catastrophic Earthquake Interim Housing Plan. Operational Area Mass Care and Sheltering Plans. To learn more, visit your local emergency management office or Office of Emergency Services. Let's test your understanding of mass care and shelter and interim housing operations in an EOC. Who has the primary responsibility for sheltering displaced disaster survivors? A. Local government. B. Operational area. C. Bay Area region. D. State. The local government takes the lead in establishing the resources to meet the needs of displaced disaster survivors. Who is your primary NGO partner to execute the mass care and shelter function? A. Salvation Army. B. Food Bank. C. American Red Cross. D. Goodwill. The American Red Cross maintains a federal and state MOU to help EOCs and local government agencies coordinate the necessary resources in the field. What elements of shelter operations need to be considered when planning for people with disabilities and others with access and functional needs? A. Accessible bathrooms. B. Doorway openings. C. Space between cots. D. All of the above. All of these customized elements plus more need consideration when planning for people with disabilities and others with access and functional needs. What operational phase of sheltering are you managing in the EOC when shelters begin to close? A. Event analysis and evaluation. B. Establishment of shelters. C. Ongoing shelter support. D. Demobilization and interim housing. Demobilization and interim housing is the fourth operational phase and provides housing services to displaced residents until they can return home or obtain more permanent housing. Thank you for taking the time to test your knowledge about mass care and sheltering operations in the EOC.